Hello, aspirants, and welcome. You're tuning into a very special high-yield explainer brought to you by Rungta IAS Academy. If you're targeting that General Studies Paper 2 Health syllabus, you are in the exact right place. I'm Faculty A, and I've got Faculty B here with me today to decode a really crucial current affairs topic, India's administrative response to the global Ebola threat.
Welcome, everyone. You know, this isn't just news. It is a brilliant case study in public health administration. It perfectly captures how international events trigger domestic policy mechanisms, and that is exactly the kind of core theme you absolutely must master for both your mains and the personality test.
All right, a quick look at today's agenda. We'll cover the global Ebola threat, India's surveillance framework, healthcare readiness, and finally, the UPSC GS2 and interview focus. Starting with Section 1, the global Ebola threat. Because to really understand our policy response, we first have to grasp the trigger. And the situation on the ground right now is quite critical. The World Health Organization recently declared the ongoing Ebola outbreak in the Democratic Republic of Congo and Uganda as a public health emergency of international concern. What that means on a practical level is that bordering nations, especially South Sudan, are suddenly at a very high risk of transmission.
Right, and you might be wondering, why does this matter to us in India? As future administrators, you need to deeply understand the underlying rationale for our response. The Health Ministry knows that even though the current risk outside that African region is low, complacency is simply not an option.
Spot on.
In our highly connected global economy, borders just do not stop viruses. Growing international trade and travel mean we strictly need adequate preparedness and response capacities at absolutely every level of our health system.
Which brings us to Section 2, India's surveillance framework. Let's see how the center is actually monitoring this threat.
So, the center has directed states to step up their surveillance. They're looking for specific warning signs: fever, severe weakness, muscle pain, headaches, sore throat, vomiting, and red eyes. Crucially, they are heavily monitoring individuals with recent travel history to the affected regions and enforcing very strict SOPs for sample collection and referral. Aspirants, I want you to pay close attention to that first bullet point, the Integrated Disease Surveillance Program, or IDSP. You need to cement this in your governance notes. The IDSP is our nation's primary radar for detecting unusual clusters of fever. When you're writing a mains answer on health surveillance, explicitly mentioning the activation of the IDSP is absolutely non-negotiable.
Absolutely crucial. Moving on to Section 3, Healthcare Infrastructure and Readiness. Because, let's face it, surveillance is only half the battle.
If a case slips through, we need to be ready. To build that readiness, Union Health Secretary Punya Salila Srivastava, that's Punya Salila Srivastava, issued some very specific administrative directives. States must identify designated isolation facilities and deploy dedicated ambulances that are fully equipped with infection prevention measures.
And it's about the logistics too, right? They need to ensure there is an adequate supply of PPE, highly trained personnel, and robust critical care infrastructure. On top of that, hospitals have been directed to reinforce their triage systems, hand hygiene protocols, and proper biomedical waste management. It is a comprehensive blueprint for crisis management.
Now just look at the seamless institutional coordination happening here. You've got the IDSP handling the ground-level surveillance. Then for diagnostics, the Indian Council of Medical Research's NIV Pune, that's Pune, is the central hub fully equipped to test samples coming from entry points or communities.
Exactly. The interagency coordination is the key takeaway. You have NIV Pune working directly with airport authorities, port health officers, and state and district units. And down at the grassroots level, states and districts are required to keep multidisciplinary rapid response teams on standby for immediate outbreak control. This right here is the exact administrative vocabulary you need to use on your exam.
And that leads us perfectly into Section 4, UPSC GS2 and interview focus. How do you actually use this strategy to maximize your score? Faculty B, take a look at the analytical question we've mapped out for you. To tackle a question like this in GS Paper 2 or the mock interview, don't just dump facts on the examiner. Build a compelling narrative. Start with the trigger, global trade and travel, and then deploy your administrative vocabulary. Talk about the Integrated Disease Surveillance Program, mention triage protocols, and highlight those multidisciplinary rapid response teams.
For sure. You want to highlight the central testing role of ICMR's NIV Pune and emphasize that interagency coordination. Showing that you understand this multi-layered approach from entry point screening right down to critical care isolation proves you have the analytical depth of a future IAS officer. But before we wrap up, we want to leave you with a provocative thought to ponder. Our reactive frameworks are definitely improving. But is India's primary healthcare infrastructure truly resilient enough to absorb the shock of the next disease X? Or are we still just fighting fires as they start? Keep studying hard, stay focused, and we'll see you in the next explainer.